I clean a fucking rabbit cage with this bitch. Them bitches left me high and bloody dry. What's up, my YouTube family? Y'all, I'm getting straight to this video. I don't have time to talk this morning. I had to go get this done today. Thank God for my friend. That was horrible. Y'all, I got on a tank top, y'all. This is not a bra. This is a tank top, period. But I'm fucked up, period. Can't wait till tomorrow, y'all. I'm so excited about tomorrow. But I'm scared because I don't know how they're going to take the wires off. Because it look like it's in my nail bed. Like, I don't know, y'all. I can't even look at it. It's like it's in my nail bed. I don't know. I'm afraid, y'all. I can tell you that. Like, I'm tired of dealing with pain. I've been dealing with pain for 4 straight weeks. I'm tired. But oh my God, y'all. When they took my case off, I just started crying even more so seeing my hand like this. So I have to keep the wires in there for 5 more weeks and then I'll be free. Come here, y'all. Y'all know that's my move. Look at this little bump coming. Like, get away, right?
That was was supposed to look alike, but she knew not been
all these moles in my face. I love them though. Got 1, 2, 3. All on my neck. Oh my God, y'all. When they took my cast off, I just started crying even more so just seeing my fingers like this. I'm like, fuck. This is the worst mistake I've ever made, y'all. But it's okay, right?
Electric shades.
This is not what I ordered.
Like, no, this is not what I ordered. This is not what I want.
Well, this would be great.
We
for her
want
and
fun.
Her son.
Yeah. Yeah.
Graduation next week.
Is that right? Awesome. Good.
Is my fingers gonna be out or how I go?
So yeah, the fingers are gonna be left free up underneath this splint so you can start some movement with them.
You don't want to actively move.
No, I'm gonna let them teach me how to do it.
We'll show you your homework today,
Yeah,
and then they will
today.
follow you up over there. We'll make sure you're taken care of. Absolutely.
Yeah, this definitely can be scary initially, but it'll get more normalized as you work with them. Okay. When are you coming back to see Dr. Bilderback again?
He didn't say. I think he's gonna release me tomorrow, I believe.
But he'll follow you up, but
we'll
we'll send you to Monroe for therapy. But he'll follow you up here for your surgery stuff. So usually he'll probably see you back in like 4 or 6 weeks. But I'll double check and make sure.
Yeah.
I'm back in 5 weeks is what he says. So
Take the pins out.
Take care of your pins out. Yeah.
Perfect.
So when the pins come out the nail bed, is it a hole?
There's a little bit of a hole, but by that time your finger and your hands are ready to get rid of the pin out. It just feels weird when they pull them because they just do it in the clinic and they just get like a little pair of like little clamps and they just wiggle it and pull it out. I had 4 and it just feels weird. It just feels weird.
It doesn't hurt.
More like a pressure.
It's more like a pressure that comes out, yeah. So, and then that little button, what they'll do is they'll clip those little wires and they just pull it because that's kind of keeping your
nail and
your tendon together
in place
in where it's supposed to be. Yeah.
How long does it take for a nerve and a tendon to heal?
Feel normal. Would I get my touch back on the tip of my fingers? Because it still feels like a vibration.
As far as the tendon goes, typically you're going to be in this brace for 6 weeks.
Yes, ma'am.
Now, you'll progress as far as your therapy within that 6 weeks. At 6 weeks, you get rid of the brace. Okay. Normally, you can't go back to like doing gripping and that sort of stuff to about 8 to 10 weeks. Most of the time, people, depending on their type of work, they can go back to work about 12 weeks. So you're going to be off for a little bit. Now, if they've got like just one-handed stuff or whatever, you can
probably go back and do phone calls and stuff.
Yeah, and do that. We have people that do it, so you're not driving yourself
crazy.
I'm like,
I can't take 30 blood pressure cuffs a day.
No,
not manual.
Yeah,
I told him I'm gonna need a automatic. I feel like at some point because I feel like I'm not gonna be able to
Now the nerve, when you cut a nerve, it's the first 4 weeks, it kind of just goes, and then it grows basically 1 inch a month.
Okay. That makes
And you'll start feeling like little, it feels like ants are crawling on your skin or little tingly feelings.
Mhm.
That's normal. That's that nerve starting to grow. People go, it drives them crazy. But but that's normal. It'll feel that way. But yeah, it's basically after the first 4 weeks, then it's basically 1 inch a month. So you have to kind of look at where you cut it and then, okay, 1 inch, 1 inch, 1 inch, So it may be 3 or 4 months before out your fingertip, so.
Yes, ma'am. Okay.
This needs to come up underneath.
Behind or under the thumb?
Yeah, I'm gonna bring those back to here, it looks like.
Okay.
And take this Velcro back. Ooh, if it's gonna peel, that's some strong Velcro. One sec, this around. It should come up like that into the web space.
Okay.
I'm gonna put it right here. Just like that. I don't tap it down too hard. I'm gonna do the same thing back here. Man, that Velcro sticks to this material.
Like it was melting in it.
Yeah. I think that stuff
that's
was
good,
still warm.
right?
Yeah. That's good. You don't want it falling off, so that's a good thing. It took me some work to get it off. One second. That should be plenty far up. So right there, this one's coming back. It's connecting like that. It's gonna get this up here. I'm sorry, friend.
It's okay. No, it's not true. It's just.
It's just hurting, I know. Let's see. Trim that on out. Trim that a little bit out. Good. Okay, now your exercises right now. Come up here like this for me. Let me help it. What you need to be doing, your thumb, you can move it freely. Keep it loose, keep it moving. Don't go grip anything with it.
Okay.
But you can move it. And your goal, you're trying to get down across the base of your pinky with it, right? And you're trying to go up as high as you can with it. Now for these fingers, I want you to treat all of these fingers like they were lacerated, like they have a tendon injury, because they're attached. Okay, you got different points of attachment. So what you're gonna do, you're gonna work this joint by joint. You're gonna passively flex at this first knuckle at first. I'm gonna show you how to do that. Okay.
Yes, sir.
So what we'll do, let me put on a glove real quick. So what you can do, you're gonna come back behind that knuckle, okay? So getting there is gonna be a hard part right here. And then you're gonna flex it down. Very gentle, just what you can tolerate.
Okay.
Now normally that knuckle goes to about 90 degrees, so that's our goal, okay? And you relax it back, and you let it go back as far as it can up. And then down.
So you control it by my knuckle.
Yeah, exactly. And you're using that hand to do it, okay? So you're taking it just where you can tolerate. It should have some pulling, should have a little bit of aching. The point of it is you're getting the tendon to glide back through its sheath, okay?
Okay.
Not letting it freeze up on you. You're getting what's called excursion to happen.
Okay.
Good. And then you're going back. So that kind of alternate back and forth. Your goal is to try to get it back to the top of that splint. Just like that. Good. And then after you've done 10 reps there, you're gonna come to that next joint. And so to do that, we're gonna come right here. I'm gonna put a finger right here. I'm gonna try to bend just at the tip of it.
So that's like right here.
Yeah, that middle knuckle, right? And just where you can do it. Good. And then we're gonna relax it back. I'm just gonna push from that point, okay?
Okay.
Carla, with the zone 1 with the button hooks, you don't do anything with the
Nothing
DIP.
no.
Yeah. Wasn't sure with her going from a zone 2 to a zone 1.
Yeah. I mean, she can do her PIP.
Yeah.
She can do her MCP, but nothing
Right there.
Yeah,
there,
nothing at that
and
distal
no
joint.
composite like that.
Right.
Yeah.
Okay.
So keep it separated how you're doing. Just how we just did there.
So I'm do the 3 fingers like that?
I would do all your fingers.
All my
like
fingers,
that.
even the pinky?
Now the pinky, these two, you can bend at the tip of that finger. She can do composite with the non-impacted digits
Yes.
to maintain joint motion.
Okay.
So with these, What you can do after you've loosened up a little bit, you can bring them down, and you can actually try to curl down to the base of, you know, where this is touching.
Gotcha.
Okay. And then you go all the way back up. And since that one can extend, you can take it all the way to the splint, okay? But these two, I want you to treat exactly the same. You're working this knuckle, the big knuckle,
and the middle one.
and the middle one. That's right. If you'll do that, you're going to maintain
the middle
motion.
one.
The middle one's going to
It's
be tough.
kind of difficult.
So you're going to have to go from right here. You feel what I've got?
And just push it back from the bottom.
You're pushing it down towards your palm, right? And again, it's only going to go to 90 degrees. You're not trying to go anything past 90 there, okay? So you're getting a good pull, it's stretching, and you're going to come back, and you're going to try to lift it back up towards the splint.
Okay.
Just where you can tolerate your goal each time. There, you feel we touched it right there?
Mm-hmm.
And then you go back down. 10 reps every hour. Don't wake up in the middle of the night to do this, but during the day, if you're moving, it's going to feel better because you're going to pump swelling
10
out
reps
of this.
an hour?
Yeah,
Okay.
That's what I would aim for.
Okay.
Yeah, for right now, treat this thing like a job, and it'll keep you from getting super stiff, okay? So going down, good. You can feel it pulling, huh?
Mm-hmm. It don't feel bad.
And just, you know, get to where you can. It's going to loosen up as you do this. Then you're going to come down to that middle joint. And again, I'm going to push a little pressure at that phalanx before. It's already kind of in a good bent position, so I'm not going to get a ton more motion there. What I'm going to try to do is get a little bit more back, okay? And so I'm going to push back. Let's see, we're going to go from here. I don't want to push down on this point, but I'm going to try to
All the way
push
back to the
here.
front.
Yep. And you just get what extension you can without it being too painful, okay?
Okay.
'Cause that button hook, it's got you curled down where it needs to be right now. We don't want to put too much stress on it. But yeah, you can try to do a little bit of extension at that joint, okay? There it goes. Yeah, you can get a little bit of extension. You saw that time, I didn't push you all the way back. I just kind of gave a push here and tried to open this space between those two joints, okay? And there should not be any sharp stabbing pain with this. It's just what you can tolerate, okay?
Are you pulling this part back?
I'm basically pushing right on this knuckle, and I'm trying to lift up just a little bit.
Okay.
Just like that to give it a little bit of excursion up into extension, okay?
Okay, yes, sir. Not underneath, just on top.
Yeah. Just like that. It's a very slight movement. And then again, when you're going down, we're not doing composite, we're doing knuckle by knuckle. We're going here, we're pressing, just where you can get to, relaxing all the way back up. And then same thing on this one, you can push down, and you try to bring it back. That one's gonna be tough to get into an extension. These other two are gonna be pretty simple. You're gonna go knuckle by knuckle, so you're gonna do 10 here, then you're gonna come back and do 10 there. You can even come and do 10 at this little distal point right there and back.
Can she do these without those casts? Would that be easier?
She needs to
I
have
needed to support so I know
Yeah.
where to stop at.
Yeah,
I got you.
yeah, for the stopping point, but also with it being free, she could extend our wrist back when she's trying to do it,
Got
and
it.
that can put too much stress on the repair. This is really to put her in a protected position so that you're not pushing back too far.
Right.
Okay.
What's up, my YouTube family? Y'all, I'm getting straight to this video. I don't have time to talk this morning. I had to go get this done today. Thank God for my friend.
That look horrible.
Y'all, I'm just in shambles. 6 weeks of physical therapy. They gotta keep the pins in my nails for 6 more weeks, 5 more weeks, one of them. So I'm in shambles. I'm so miserable. Oh, she wants to show her shades. Don't play. Don't play.
Right, we gotta wear shades.
I got on a tank top, y'all. This is not a bra. It's a tank top, period. But I'm fucked up, period. Miserable, period. Do you see them nails in my finger bed, y'all? I'm not gonna be able to get my nails done in forever. You'd think they would have cleaned my incisions better than that, but they depended on me to do that. So it's fine. I'll ease my way to do it. I'm gonna make some dial water, right? And draw it up in a syringe and clean it. And my husband and I are gonna have to Take our time. Y'all know they said to use alcohol rub. How the fuck am I do that? I can't even let fucking wind hit it, let alone alcohol. So I'm gonna take it slow by using Dial soap. They said I could use Dial soap, mix it with some water in the bucket. I should ask her, can I use the
And then you take
the soap kind,
and then
the liquid
you
form,
take,
a Q-tip and clean it around it.
clean around.
I may have a few more Q-tips, but I'll come get some more from the job. Oh, get a 3-finger combo for me and get what you want.
A 3-finger combo.
We getting some Raisin
What do you want
Canes.
to drink?
Lemonade. Lemonade. I'm so happy to see my friend, y'all. I done spent all morning with her, literally all morning. I'm fucked up.
Leprechaun lemonade.
Leprechaun, what's that?
It's green.
No, I don't.
Our classic.
I'm gonna have a green shit.
You just.
Yo, I'm gonna post a video
green.
showing how this fitting went and how I'm supposed to treat my life. So, y'all, I'm gonna be 30 pounds lighter from stressing over this bullshit. I already done lost 15. Do it look like it? No. But I done lost 15 pounds dealing with this shit, y'all. Can't get up when I want. Oh, another thing I wanted to tell you.
You can rake my
Any of y'all
flour there.
in... Oh, no, fuck no. She said I can rake her flour bed. Let me tell y'all not fat. I'm telling y'all, anybody that work in the medical field, you are not fat. You're just...
Hey, want chicken today?
Yes, ma'am.
You're just working at a job that brings too much food for
I
free.
need 2 3-finger combos. One with lemonade, please. And one with sweet tea.
One with extra cane sauce. If you want an extra, get it too.
Ma'am.
What else can I get for you?
And an extra cane sauce in one of them is fine.
Yes, ma'am. What else?
That'll be it.
2081 Nixon, thank you.
Thank you.
Period. We getting us some Raisin Canes, y'all. I'm still fucking handicapped. I can't do shit.
You got a scooper.
I clean the fucking rabbit cage with this bitch.
Clean the grill.
If it was a suction, I'd vacuum something. I'm gonna hit me a bitch with it if they don't quit playing with me. That's what I'm gonna do.
That is true. It does
I'm gonna
look
golf.
like
Bitch, shut up.
it does look like a hose from the what do you call that?
What?
Vacuum cleaner.
The one.
Yes, ma'am.
Say hey, YouTube.
Hi.
She was a sweet girl.
Hey, do y'all need your grill clean? She's got a scooper she can do it for you. Y'all need a scooper? She can clean your grill for you.
You see how she talking about me? Y'all, she ain't shit.
I don't think that's safe.
Exactly. You're
What'd she
absolutely.
say?
She don't think that's safe. You're absolutely correct. Them bitches left me high and bloody dry. But, yo, I'm stressing. I can't lie. I'm stressing. People say in 6 more weeks I'm gonna be out of work, girl. Unless you can do one-handed stuff. That's what she said. Like, they could have put like a fucking bandage over my nail bed. Cause when the air hit it, it's fucking burning. I can't even have that on my YouTube, so I'll be back. They gave me some leprechaun lemonade, y'all, and I'm on 10%. But I'm gonna take some of that medicine down there, cause they got me fucked up. So y'all, I have me some Raisin Canes, a 3-finger count, y'all. I cannot use this hand. So y'all get the picture.